My name is Q. I'll be your student nurse today. What I'm doing is doing a quick head to toe assessment on an infant. So what I'll start is by identifying myself, which I already have done, and then I'll verify that I have the correct patient. So I'll look at the baby's armband and verify it with mom's armband, and then I'll check the baby's settings or surroundings to make sure that it's safe. I'll wash my hands and I'll place my gloves on to start the assessment. As I look at this assessment, I'll look at the behavioral state of the baby and I'll note that this baby is quiet, alert. The baby's not crying, the baby's not sleeping, the baby's alert, awake, and calm to do this assessment. So I'll start with the vital signs and then I'll get the baby's respirations. I'll count those for an entire minute. After I count those for an entire minute, I'll get the baby's apical pulse. I'll attain that for an entire minute. And while I'm in this area, I also can listen to note if I hear any heart murmurs. The baby has no heart murmurs, that is noted. So the next thing I'll do in the respirations and pulse is heart rate is within range. So the next thing I'll do is measure the baby's height and head and chest circumference. So I'll measure the height by putting the measuring tape from the top of the head to the bottom of the foot. And then the head circumference, I'll wrap it around the head using the baby's eyebrows as a landmark. And then I'll wrap it around the chest using the baby's nipples as a landmark. After I attain those measurements, I'll then weigh the baby to see how much the baby's weigh. If the blood pressure hasn't been taken already, I'll take the blood pressure, place the cuff around the baby's calf, and then lastly, I'll get the baby's axillary temperature. So as I'm assessing this baby, I'll also note that there is vernix present. The vernix present is a cottage cheese substance that we'll notice underneath the chin, in the folds of the arms, or in the folds of the legs. That's normal and it'll go away eventually. The next thing that we may note is going to be lanugo, which is the baby hairs, could be on the baby's shoulders or on the baby's buttocks. While I'm assessing everything else, I'll look at the baby's overall appearance of the skin tone and look at the extremities to see if I see any discoloration, purple, bluing, indicating that the baby may not be getting proper circulation. This baby skin tone is even on throughout, so the baby's circulation is great. The baby is moving equally. All of the extremities are symmetrical and equal in length. I also note that the baby has all 10 toes and all 10 fingers, which is great. After I feel the baby and see that the baby is warm to the touch, which is also indicative of good circulation. So after I'll do that, I'll assess the baby's head. I'll assess the baby's head by looking at the baby's shape, the molding of the head. This baby's head is circular. It appears to be normocephalic. There is no caput. There is no cephalhematoma, and there is no petechia. Cephalhematoma would be noted if there is like any bulging or red spots, which could be indicative of blood clots. Petechia would be swelling of the baby's head, which could be from the pressure when mom was pushing, but none of that is noted, and this is why we said the baby's head is normocephalic. What we may also note is that if you look closely, you'll see that there is slightly erythema on the baby's cheeks, which is like baby acne or a baby rash. That's normal as well. That's just the baby adjusting to the external environment outside of the womb. We may also notice milia as well, which will be noted on the little dots on the nose, the forehead, the cheeks, or the chin. That's normal, and that will also go away as well. We'll also, while we're noticing all of these things, we'll take a look at the face. We'll see that the face is symmetrical. We'll see that the eyes is symmetrical. We'll also see that the eyes are aligned with the top of the ears. We'll also note that the baby's eyes are gray Irish color. The baby will attain its permanent color as it gets older. The next thing that we'll look is at the baby's conjunctiva, and we'll want to look for signs of conjunctivitis such as redness, discharge, watery eyes, cloudy eyes, anything indicative of an eye infection. But this baby's eyes look great. What we'll also look at is is there any strabismus, which is a lazy eye, which this baby does not have as well. What we'll also note is we'll get our pen light out. And as we get our pen light, we'll assess the pupils of the baby. So these pupils are equal, round, and reactive to light. Their eyes have not started accommodating yet, but right now this baby looks to be in great shape. The next thing that we will note is gonna be the fontanelles. We have an anterior and we have a posterior. We just want to rub our fingers across the fontanelle. One is here and one is here, but just rub down, you'll feel those fontanelles. You may even feel it pulsating, but what you want to feel is flatness. You don't want to feel it bulging. You don't want to feel no indentation. Anything that is indicative of any swelling or abnormality. So this baby's fontanelles are flat right now, which is great as well. So the next thing that we will assess is gonna be the baby's nose. We want to take a look at the baby's nose and make sure that the baby's nasal passageway is patent, because babies are nose breathers. So how we can look for that is to see if there's any nasal flaring. And then we can also cover one nose and see if the baby is effortlessly nose breathing out of each nostril. That'll let us know that it's patent. The next thing we'll assess is the baby's ears. We want to see that the baby's ear shape is also symmetrical, and we want to see that it is well formed with no lumps, bumps, no abnormalities or deformities. It's just well formed in shape. The next thing that we'll look at is the baby's mouth. When we're looking at the baby's mouth with our gloved hand, we'll place our hand in the baby's mouth and we'll scale across that palate. We're checking for any openings. There's no openings here, but we also want to note to see if there's any Epstein pearls. If there are Epstein pearls noted, that is perfectly normal, and those will also go away as the baby continues to grow. While your finger is in the mouth, we can use this opportunity to check for the sucking reflex. We'll check for the swallowing reflex as we assess the mom and baby feeding time. And then we can also check for the rooting reflex. So as you swipe your finger across the baby's cheek, the baby's head should naturally go in that direction, almost as to initiate feeding time, looking for that nipple. So as we look for those things, the next thing that we're gonna assess is gonna be the baby's neck. What we're checking is that the clavicle is intact, that there is no injury that could have occurred during birth. This clavicle is intact, which is great. So the next thing we'll take a look at is going to be the baby's chest and abdomen. As I said earlier, we already listened for murmurs. There were no murmurs noted. And we've already attained the baby's heart rate, which was within normal range. What we could also note right now is listen to the baby's lung sounds while we're in this area. So the baby's lung sounds is clear. We can also listen to the bowel sounds as well, making sure to visit each quadrant. Keep in mind that we may not hear any bowel sounds if the baby has not had its first feeding, but if the baby has eaten, we should hear some bowel sounds. The lung sounds are clear right now, but if you do hear anything in the lungs, that could just be the residual amniotic fluid that's remaining in there that hasn't had time to get out as well. So while we're looking at the abdomen and the chest area, we'll also take a look at the umbilical cord. We want to make sure the umbilical cord is still intact. It will fall off after a few days or so, but we want to make sure it's clamped, it's intact, there's no redness, no drainage, no swelling, no rashes, nothing that's indicative of it being infected. So after we take a look at that, we'll then go down to the genital areas. Right now, this is a baby girl, so what we're looking for is the labia majora. We want to make sure that that labia majora is covering the labia minora. If we were assessing a male baby, what we would look for is to make sure that the meatus is centrally located. We want to make sure that the testicles has descended, and then we also want to note that rugae on the scrotum. While we're checking the baby, what we're looking for in addition is to see if the baby has had their first void. Is this baby getting hydrated enough? Has this baby peed? And also, has this baby also had their first bowel movement, which we call meconium? That would be a black, dark, tar-like stool that we're looking for, but we're looking to see that that baby passes that first void, that first stool. That is what we're looking for when we're checking these diapers. And then we can also look for the Mongolian spots on the back of the baby's buttocks as well. But you want to look overall for those Mongolian spots. If those spots are noted, what we should be doing is making sure we're documenting that in the baby's chart so that it's not indicative of any abuse. Because sometimes the spots can look more so like bruises if it's not noticed in the chart and maybe it wasn't noticed initially. So now that we've looked at the baby's private areas, we are now going to look at the baby's extremities. As I said, the baby is moving all of its extremities. What we're going to assess now for is the baby's range of motion. So we'll kind of bend the leg and then bend it outward, and then bend the leg and then bend it outward. And what we're listening for is that popping sound. The same way we assess the clavicle, we're listening as the baby is moving those extremities for the popping sound to see if there is any dislodgement present. This baby's range of motion is great. While we're here, we can also do the plantar grafts reflex, which means we'll put the finger there, the toes are clasped around the fingers. We can also do the palmar grasp reflex. Place your finger around the baby's hand and the baby will grasp as well. We can also check for the Babinski reflex. We'll just slide our fingers around the sole of the baby's foot and their feet should spread out. That is the response that we are looking for the Babinski reflex. The next thing that we would note is going to be, we'll check out the baby's back and spine. This will be the perfect timing. So you'll rub your finger down the baby's vertebrae and you just want to make sure everything is closed, that there's no curvatures, that everything is just straight and there's no lumps, bumps, anything indicative that the spine could have also acquired some form of injury during labor and delivery. So as we're looking for that, we can also assess the trunk incurvation. We'll slide our fingers around, that's a reflex, and the baby's reflex should be their body should flex on the side where you're swiping down. That is called the trunk incurvation. That's what we're looking for. We've already looked at our Mongolian spots. The next thing we could do while we're holding this baby is the stepping reflex. We'll hold the baby up as if it's gonna walk, and the baby should imitate walking. Lift one foot and lift up the other. The next thing that we could take a look at is going to be the it's gonna come the neck. No. The neck reflex, which will be like if you turn the baby's neck, the extremities should spring out in that direction and the other one should come in forward. And it should do that vice versa. Turn the neck and the extremities should spring out and the opposite should come inward towards the baby. The last one that I would say to check for is going to be the Moro reflex, because this one may startle the baby, but will act as if we're going to drop the baby. The baby should respond with a shocked response, almost like all the hands and legs will spread out and the palms will face upwards towards the sky or the ceiling because they are startled. So that is the Moro reflex that we would be checking there. And I say do that last because that may actually initiate that crying response. So I want to say thank you for watching this video, and hopefully it was helpful.